Hey guys, Dr. Peoples here, and this is video 2 on my update on COVID and my assessment of what's going on. So, in the last video, we talked about the difference between the flu and COVID and why this is very, very different. And now we want to talk about some of the more practical issues about what you should do, what sorts of symptoms you should be looking out for, and what you should do if you get symptoms. All right. So, according to the CDC website, the main symptoms are going to be a dry cough and a fever. A fever is anything above 100.4. I don't know if they're considering a fever 101 at this point, degrees Fahrenheit, but typically we consider a fever anything above 100.4. So if you have a dry cough and a fever, you should consider the fact that you might have COVID. Now, a dry cough and a fever could be walking pneumonia. It could be the common cold. It could be the flu. It can be a lot of things. But we want to assume that you are a person of interest is the term that we're using in the medical field to describe people who have symptoms but who have not had testing to confirm their diagnosis. The other big symptom might be shortness of breath. And I want to talk a little bit about what you should do if you have symptoms. And this is a really big concern. And I was talking to some of my ER friends about what's actually happening on the ground right now in the emergency rooms if you come in with a cough and a fever. Now, all of this is sort of intertwined, but the issue with testing, which we'll talk about in a second, is limiting who we can test. So if you go to the ER with a cough and a fever right now, you are unlikely to be tested. We just don't have enough tests. I think we're processing like not even 100 tests in the state of Georgia right now a day for COVID. And this is well underrepresenting what we actually need to be testing. So my first advice would be is once you develop symptoms, you need to make sure that you are being really diligent about yourself, your social distancing, and really self-quarantining, meaning, not just not going out of your house, but really distancing yourself from your family members, especially if they're elderly, especially if they have other chronic illnesses. And you want to, even your pets, according to the CDC. So you want to distance yourself from everyone. And you should call your healthcare provider because they're going to be able to give you information about your specific needs and whether or not you need to be seen in the office or if you need to be seen in the emergency room. And that's important because we're all different. And if you are a person who had a kidney transplant or are on immunosuppressive drugs because you have psoriasis or lupus, or if you're a person who has cancer, or if you're pregnant, if you're in those high-risk groups, then your healthcare provider will be able to give you more specific and personalized instruction. But for the average healthy individual who just has a dry cough and a fever, I would not rush to the emergency room to get tested because you are more than likely going to be sent home and you will not be tested. Now, ideally, and from an epidemiological standpoint, we really need to be testing everyone who has symptoms. But we just don't have the capacity as of March 19th today. So until we have that capacity, if you have these symptoms and you've talked to your healthcare provider and they tell you to stay home, please stay home. And the reason is that there are a lot of reasons, but the big reasons are going to be, number one, if you do have COVID, you do not want to spread it to other people in the hospital. And if you don't have COVID and you go to the emergency room, then you are likely to contract COVID. So you want to stay out of the population either way. And then the reason that's also very important is because as we see the numbers of people being infected going up, which we will see, as we see those numbers go up, the hospitals are going to become very overwhelmed, particularly our ERs and our ICUs. And so we want to limit the number of people who are just coming through just to get a test. Hopefully we'll get these drive-through testing facilities up and running soon. I have no idea why testing is such a problem right now, but it is. And so if you have a dry cough and a fever and you have spoken to your healthcare provider, I can say it again, stay home, self-quarantine, social distance. Okay, so what are some situations where you might want to go straight to the emergency room? So according to the CDC, if you have shortness of breath or difficulty breathing, you do not want to sit at home and wait for that to get worse. You want to go in and make sure that a medical professional assesses you to determine what to do next. If you develop confusion or you have difficulty arousing, so if you have a loved one who's in your home and they become confused or they're really hard to wake up, or have persistent pain, you want to make sure that those people get to the emergency room sooner than later. And then if you notice that you start to develop bluish lips or bluish ears, those symptoms, things like that would be indicative of not getting enough oxygen, meaning that you have a disease that is affecting the lungs, and it's severe enough to limit oxygen to the rest of the body. So obviously that person would need to go to the emergency room as well. So those are your indications for going to the emergency room. Be really prudent to call your healthcare provider before making a move, if you do not have any of these 4 symptoms here. Okay. Now let's talk a little bit about testing. And this is a huge, huge, huge deal right now because without testing, we really don't know what we're dealing with when it comes to this disease. And I was just listening to something today, and I think since January, the United States has tested 60,000 people. Compare that to China, where they have tested 300,000 people. And so since January. So if you look at this graph, the only thing I want you to get from it is that we're just way behind. We're behind everybody when it comes to testing. And honestly, I cannot tell you why we don't have access to the same tests as people around the world. I don't know why. I can tell you that some of the limitations are that, number one, either we don't have tests or we have difficulty with the components of the test. So maybe not having the right swabs, maybe not having the right reagent to extract for the process of analyzing the test. We may not have enough people to actually process, or the right machines. So there's a lot of stuff in the chain to make sure that we get adequate testing done, and we're just not getting it done. And even if you do get tested, it's depending on where you go, and this changes from county to county, state to state, but depending on where you go, it can take up to 2 to 3 or even 5 days for you to get your results. So what are you going to do in that meantime anyway? You're going to self-quarantine. So again, this is why it's so important. And remember, even if you're not having symptoms, this is why everybody is encouraged to self-quarantine or to social distance, because you may be carrying the virus unknowingly and passing it along. And I could be carrying it. I mean, it's just that serious. And so we really need to take this really, really seriously. We'll talk about that in the next video. So thanks for watching. And until next time, I wish you guys optimal health.